All right, we're live on a Friday night. I'm still at work. Not sure why, but I'm committed to the cause. So I had a patient come in today from Mexico. He's here for a month to get treatment. And we went through all the exercises he was doing. And he was doing one that was absolutely he shouldn't be doing. And it tends to be kind of the theme of the week is don't do the things that make you worse. And it depends on what type of back problem you have and your biomechanics and what you do on a daily basis as to what exercises are good for you. We have a very specific way of identifying that, but every single day, patients that we've been working with, even for a while, sometimes exercises creep into their program, not from us, but maybe from somebody else, that make them worse. So, but there's one exercise for a very specific type of hernia disc, you never, ever, ever, ever want to do it. And sometimes it's the same sort of mechanism that actually caused the herniated disc. And doctors and physical therapists give this exercise sometimes to patients with herniated disc. And he had a herniated disc for a long time and had been doing this for a long time. And sometimes the things that you do throughout the day really prevent the pain from going away, even though you think you're making it better. He was doing a lot of right things, but doing a lot of wrong things. But not his fault. So this is about the one exercise you do not want to do if you have a herniated disc. We are at the Illinois Back Institute. We've been treating back pain for 25 years. We're on a mission to eliminate back pain from the planet, and it can be done. Absolutely, I believe it in my heart. It can be done. This is our disclaimer. See a doctor. Okay, this is not a diagnosis. These are educational purposes. You need to get educated. Again, my mission is to eliminate back pain from the planet. It can be done. So, herniated disc. Different types of herniated discs. There's small, medium, and large. Okay, it's kind of vague, but what happens is you get a tearing of the outer portion, the outer shell of the disc. The disc is a lot like a jelly donut, okay? Between the head and the hips, there's 24 vertebrae. In between each vertebrae, there's a disc. The disc is like a jelly donut in the sense that the outside of the disc, there's a thick material that we call the annulus. Inside the disc is the jelly. The jelly can move. And under repetitive stress and repetitive loads, what happens is the disc will start to break down. And sometimes what happens is the nucleus pushes out. This is the top view. Here's the jelly pushing out on the annulus. The annulus will start to tear a little bit. It's called a fissure. Fissure is a little tear. Okay? What happens over time is the nucleus pushes further out. So this is sort of the smaller herniation, and then the medium, and then a large one where it tears all the way through. But the tear is the fissure. And it doesn't have to tear all the way through because it starts to tear and the nucleus pushes out. Now, if you have a tear, you do not want to do rotational exercises. Okay? So the one thing that we know is repetitive stress. A lot of motion on that disc will aggravate the disc. Compressive loads. But another thing is rotation. And what very often the doctors do is they prescribe an exercise that is rotation. So if you have a fissure, and what they give is called double knee rotation. So you rotate the knees left and right. This is a patient laying on his back after Halloween, of course. And what happens is with the double knee rotation, what happens is they want you to loosen up your hips, but the pelvis and the spine starts to rotate. You do not want to rotate the pelvis and the spine on a fissure. That will hurt it. Repetitive stresses aggravate the disc. We talked about this yesterday. So if you have a disc problem and you benefit from forward motion, but you get worse from backward motion, every time you go back, you're going to aggravate it. Same thing, every time you rotate, you're going to aggravate it. So you really need to identify what it is that you're doing that's aggravating it. The exercise you never ever want to do is rotation. You rotate on the fissure, the tear, what happens is it opens up, and then it gets aggravated, more inflammation, opens up, gets aggravated. It's like if I cut your hand and you had an open wound and we sewed it up, but then you were doing this all day long, it's not going to heal properly. Why is it not going to heal? Because you keep opening it up. Same thing. Every time you do something that opens it up, you prevent it from getting better. Again, it comes back. And then the inflammation in and around the disc starts to aggravate and get inflamed on the nerve. And nerve inflammation will start to cause the spinal cord. We did a video on that called the dorsal horn. And then you get central sensitization, where it's hypersensitive. You have pain all the time. Simple touches hurts. Okay, that hurts. It shouldn't hurt that much, okay? Because it's oversensitive, because too much inflammation. So the goal is to always avoid the activities. We have 10 steps. Number 1 is really understand why you have a problem. Number 2 is understanding what makes it worse. And then number 3 is avoid the things that make it worse. It sounds really simple, but it is. Okay? You have to figure that out. But one of them is double knee rotation. Do not do it if you have a fissure, because you're going to aggravate the disc. If you don't get better and you're not getting better, then you're doing things that make it worse. There's a real specific way to solve that through stabilization, but also decompression, which is what we do. But standing, sitting, lying down, bending, if you do that wrong every day, you're going to make it worse every day. You say, why am I not getting better? Okay, why? You don't have to live with it, because you're doing the things that are wrong. Stop doing those things, you'll feel better. There is a right way and a wrong way. Again, every time you do something that aggravates it, you're going to open it back up and it's going to get worse. We have the ability to solve these problems. Avoid the activities that make it worse. We decompress it, get the inflammation down, disc slowly moves back to the inside. Combination of both those things makes you feel better, makes the herniated disc go away. We have that ability. Okay? Illinois Back Institute, we've been doing this 25 years. If you like the video, click the like button. If you don't like the video, click the like button. Somebody's been giving me a thumbs down lately, I'm not sure why. Subscribe to our channel, share our information, and ask questions. Okay, our goal is to eliminate back pain from the planet. It can be done. If you avoid the activities that make it worse, 7 minutes, how many minutes was this? No way, 2 minutes. I was going to make this a short video. Somebody said make the videos 5 minutes. If you have a disc problem, we can help you. Give us a call. 888-959-6816. Friday night, be careful. Have a good weekend. I'm done. Goodbye.